Okay, good afternoon, everyone. My name is Alberto Liuzzo Scropo. I'm an analyst in the performance analysis team in the Southeast region. And this afternoon, I will talk to you about the what we call the trend variation detector tool, which is a tool that we developed in order to identify when the growth phase of for COVID hospital demand was starting, accelerating, or slowing down in order to informed decision about elective care and mutual aid between the system. So a little bit of context. I joined the NHS in the team in January 2021, so in the middle of the first COVID winter. At the time, there were up to 1,400 deaths daily deaths in the United Kingdom, and in the Southeast region. In particular, there were up to 40% of acute bed hospital occupied by patients with COVID, and up to 650 new COVID cases every day. So we need something that helps us to identify early signal of when exponential growth for COVID hospital demand was starting, accelerating, or ending. And we needed to improve what we were doing at the time, which was a manually calculated doubling curve approach to be fitted on the existing data. So I found this paper from Perlet Altri, where they were presenting new methodologies based on hybrid Shewart chart application applied to COVID deaths, and this method was able to detect early variation in trend of, as I said, COVID death. So in this paper, they identified the three phases: at pre-growth or low plateau phases, where there were very few deaths, then the exponential growth phase, second phase, and then at post-growth, where the number of the daily values were again plateauing again at the higher level and then starting to decrease. Here you can see a chart, an hypothetical chart as an example of these three phases. And here you can see the method applied to the number of deaths in the United Kingdom between March and April 2020. As you can see, this method calculated a center line and an upper and the lower limit, and those are the limits that allow to understand when a phase is ending and the new phase is starting. So, as I said, we were not interested in COVID deaths. We want to apply this method to hospital demand. In particular, we wanted to apply the method to two different things. One is new hospital cases, so daily new cases of new cases in hospital, and as you can see also visually, these are this metric is very similar to the number of deaths, and every daily value does not depend on the value of the previous day. The second metric that we want to apply this method for was hospital bed occupied, and in this case, you can see that the curve is more smooth, and this is because at a certain level, today's value partially depend on the previous day value, because we were expecting that at least some patients that were in bed yesterday will still in bed today. This implies that there is less day variation, and we need to find slightly different approach, in particular for calculating the limits, because the calculation of the limits depends on the daily variation. So I will not bore you with the mathematics, so I will skip to the criteria we use to understand when the phases were ending. We use two different rules. One is 6 consecutive data points above or below the center line. This gives us more than 98% probability if we have 6 daily values above or beyond the center line. We are expecting that 98% of the time this is not a random variation. Usually we, for other applications, we use 7 or even 8 points, consecutive points. But in this case, we had to balance the urgency to know as early as possible that there was a variation, and the to have a certain level of certainty that it was actually a real non-random variation, so a special cause. The second rule was a single data point outside the control limit, so below the lower control limit or above the upper control limit. And then we also use a flag system. We had an amber flag when one or the two rules was triggered, and then a red flag when both rules were triggered. This really didn't change too much This didn't really change much the effectiveness of the tool, because usually the two flags were very close to each other. But yeah, we use this double flag because we use only 6 points, consecutive points. So it was kind of a way to balance a little bit this little less. Yeah. Thank you. So once we were happy with the mathematics and the criteria, we decided to validate the tool. And to do that, we took all their data, and in particular, I looked at the start of the December-January wave. As you can see, pointer. Yeah, let me see it. Yeah, I calculated the limit for the phase 1, and I keep it constant. And then I went to mark each point with the correspective flag that would have been triggered. As you can see, using this method, the changing phase would have been flagged almost 2 weeks earlier than when it was clearly visible using just the naked eye. Similarly, for the end of this winter wave, so mid-January 2021, I did the same thing. So you can see the limits. This was linear growth. So there is the center line and the two upper lower limits. And again, I marked the points, and you can see that approximately 1 week earlier than it was clear from the chart that this curve was, the growth was growth-handed. We had the first amber flag here. So from when we started to use the tool, which was March 2021, we use it regularly to monitor the trend of hospital demand for COVID, and we were running daily, so we were adding daily data to this tool, and we distributed the finding of the tool to regional directors and to the integrated care system leads. This allowed the region and the system to take informed decisions about elective capacity and mutual aid, and with of course, the ultimately resulting in better care for patients, and also importantly supporting the staff well-being. At the moment, we're still using this tool during winter, of course, usually not running daily, and also since COVID is not the only pressure at the moment. We use this tool in combination with intelligence about flu, RSV, other respiratory viruses, and the cold weather impact. And depending on the period of the winter, it could be twice a week, 3 days a week, or sometimes every day, depending on the pressure that there is. We put this information all together and again send the results to the region and the system, so they can have a better understanding of what kind of pressure they should expect in the following days and weeks. So very quickly, I went quickly, so I think that there is time to.
We've got 5 minutes for questions, so.
When the process enters the new phase,
yeah,
did you have an approach to resetting the model or recalculating the?
Yes. So the tool works. So the method implies that you will use a starting date, and of course, when you are in phase 1, the starting date is the first day that you have data, and then every day is a new data point to calculate your limits. We'll go more into specifics. So the method suggests to freeze the limits after 20 days if there is not a change in phase. If the phase, so the criteria are triggered, the flag are triggered, then you take the first point as a new start date, and then you probably want to wait a few days, so 5 days, and then you can use the day that flag the trigger the tool as a first date, and then it will start again the same process. So the new data will be new data points, and then the limits are calculated from that point.